Good morning. This is Dr. Tarek. Today I am going to discuss medical terminology of GIT, some more medical terms. Gastrointestinal tract is also known as alimentary canal because it nourishes our body. Whatever form we eat our food, our body cannot digest in that form. So the role of the GIT is to convert them into simple forms like lipids into free fatty acids, proteins into amino acids, and carbohydrates into simple sugar, and they are the forms our body can absorb. So let us start with the different words of the medical terminology. We start from the or mouth, oral drops, oral tablets, oropharyngeal. Stomach is opening of the mouth. Stomatitis, infection of the stomach or inflammation of the opening. There is a disease which causes brown pigments all around this lips, upper lip and lower lip, that is known as Pets-Jaeger syndrome. We go inside the mouth, we have tongue, and there are two words used for tongue, lingu and gloss. Lingu, we make sublingual. We take a thermometer to when we are recording the temperature sublingually. We take nitroglycerin tablets sublingually for relief or in chest pain, and we take aspirin sublingually. Then we have gloss. Gloss is another word root for tongue. Glossitis, glossectomy. Right side of the tongue has no connection with the left, and left has no connection with the right. So if there is cancer of the tongue, we can cut half of the tongue which has cancer and spare the other half. This is known as glossectomy. Glossitis. Glossoplegia. It can happen in hemiplegia. Next word is odont. Odont means tooth. Odontist, a specialist of the teeth. Gingiva. Next word is gingiva word root. This means gum. Gum is a specialized mucous membrane that covers the teeth and bone. Gingivitis. Gingivectomy. If in chronic gingivitis there is bad smell from the mouth, foul smell rather, and we have to remove that area where there is chronic infection, we have to do gingivectomy. It will regrow like the liver regrow, it will also regrow. From the tongue we go to pharynx. Pharynx, the word root is pharynge. Pharynge. I told you the medical terms are always made from the word root, never from the English meaning. So pharyngitis, pharyngectomy, pharyngoplegia. Pharyngoplegia occur during hemiplegia. The muscle of the throat can be affected. Then is food pipe, esophag, esophagus. Esophag also mean to eat, to swallow. Dysphagia, difficulty in swallowing, eating. Aphasia, no eating, no swallowing. Gaster. Gaster is stomach. Gastrodynia, pain. Gastritis. If the mucous membrane covers the stomach from inside, if they are superficial wound to the mucus, they are known as gastritis. But if they are deep wound that go into the wall of the stomach, that is known as gastric ulcer. That is stomach. This food pipe, pharynx, food pipe, stomach, small intestine start three parts. One, duodenum, black is jejunum, and third brown is ileum. Then is first part of the large intestine is known as cecum. Then ascending colon, transverse colon, descending colon, sigmoid colon. Sigmoid means S shape, it's like S. Then rectum and anus and that sort. When the food pipe joins with the stomach, there is a sphincter known as cardiac sphincter. It has nothing to do with the heart, but it's because this area is known for the on the chest. It is known for the heart, so that's why its name is cardiac sphincter. Otherwise, it has nothing to do with the heart. When the stomach joins with the small intestine, there is another valve which is known as pyloric sphincter. The role of the sphincter is just to allow the traffic in one direction, not in the reverse direction. If they allow reverse traffic, this valve is gone. It should be fixed or should be replaced. The word root for small intestine is enter. E-N-T-E-R. Enter. Enter. So enteritis, infection of the small intestine. And the word root for large intestine is col or colon. Colo or colon. Colitis, colectomy, colonoscopy, colostomy. Colostomy is making a surgical opening between the large intestine and the body surface outside. Look here. This is colon. There's supposed to be a cancer here in this area, and surgeon doesn't want feces to go in that area. It will be painful, so it will increase the disease. So surgeon will not jump into the surgery. It will make this into two-stage surgery. First stage, he will cut it from here and make an opening on the skin outside, and then attach a colostomy bag. And the feces will directly go from here to here. They will not go to this area because there is cancer here or here. So surgeon will put the patient on antibiotics for like 2 weeks, 3 weeks, and when this area will be sterilized, then surgeon will remove the cancer from this area. They can reunite this area and this area again, or it may remain like this forever. So this is colostomy and colostomy bag. Regarding three parts of the small intestine, duodenum, jejunum, and ileum. The word roots are jejun, duoden, jejun, and ileum. Duodenitis, duodenectomy, duodenoma. Jejunitis, jejunectomy, iliofemoral, ileostomy. Like we can do ostomy with the colon, we can do with the ileostomy. Then the bag will be known as ileostomy bag. I told you there are two ileum in the body. One is ileum and one is ilium. Ileum, ileum is a part of ile is a part of ileum, small intestine, because this ileum has E and small intestine enter has E. This has E and enter has E. So this ileum with E is a part of the small intestine. The other ileum, ilium, is a part of hip bone. HIP, hip has I, so it has ileum. So that ileum which I is a part of the hip bone, and this ileum with E is a part of the small intestine. Next word root is sigmoid. I showed you this sigmoid. Large intestine take a sharp turn here and become a S in shaped. And sigma means S in Greek language. So this area is known as sigmoid colon. And the importance of this is it takes a sharp turn, so feces always stay here for some time, and they can cause cancer in this area. This area is very notorious for having cancer and amoebiasis. We have a scope known as sigmoidoscope. We can enter through the rectum, go into the sigmoid colon, and visualize from inside if there is any ulcer or is there any growth. If there is any growth, we can take the biopsy and we can send to the lab. Next word we have recto and procto. They both stand for rectum. Rectalgia, pain in the rectum. Proctalgia, pain in the rectum. Proctoscopy, surgical visual examination of the rectum from within. Rectocele, herniation of the rectum. Rectorrhaphy, stitching of the rectum. Next word is pepsia. Pepsia means digestion. Dyspepsia, difficulty in digestion. Apepsia, no digestion. Anorexia. Next word is anorexia. 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 Condition of no appetite. A and N mean no. Rex mean appetite. EI is condition of. So condition is condition of no appetite. There is a more advanced stage, anorexia nervosa. Patient is fearful, phobic of the food, because patient think the weight will increase and he or she will look ugly. Usually these are girls. Next, opposite to it is, next word is bulimia. Bulimia means fringe eating, too much eating. And next stage of the bulimia is bulimia nervosa. The patient again become phobic and but takes too much food and then start having purgative and start having vomiting and use diuretics. So the weight does not increase and this food may come out from by vomiting or by motion. This is bulimia and anorexia. This word is appendico. Appendico is a word root for appendix. Appendix is a worm-like structure that is hanging at the junction of the ileum with the cecum. If there is infection here, that is known as appendicitis, and we have to surgically remove it. Very common operation, appendicectomy. We are still not clear about the real function of appendix, but it is being said that it has a role in the immunity of the body. Next word is ceco. Ceco. Ceco it stands for cecum. Cecum is the first part of the large intestine. It is hanging down from the ileocecal junction. There is no specific significance of cecum. Next word is hepat. Hepat means liver. Hepatitis, hepatoma, cirrhosis of the liver. It is degenerative disease, but when it is healed, it is replaced by fibrosis, and that is non-functional. So the quite a big part of the liver become non-functional. Cholecyst. Cholecyst, chol means gall or bile, cyst means bladder. So cholecyst means gallbladder. I told you we have two cysts in the body normally. One is cholecyst, that is gallbladder. One is only cyst, that is urinary bladder. Colidoco. Colidoco means biliary tracts in the liver. Biliary passages from where the bile is coming and being stored in the gallbladder. Bile is not a production of gallbladder, remember it. It's a production by liver and it has passages. Small ductules through these passages, the bile travel and go to liver, to gallbladder, and it is stored there. Because the function of the bile is to digest the fat in the body. When we will eat fat, then the message will go to gallbladder, constrict, and gallbladder will constrict, and the bile will go into the small intestine, and then it will digest the fat that is present in our food. Then word is lith. Lith means stone, and isis means condition of. Cholecystitis, infection in the gallbladder. Cholecystolith, stone in the gallbladder. Choledocolithiasis, condition of stone in the common bile duct. Choledoco is common bile duct. Cholecyst is gallbladder. Choledoco is common bile duct. Choledocolith, stone in the common bile duct. Choledocolithiasis, condition of stones in the gallbladder. Pancreato, Pancreas is the word root for pancreas, which produce insulin and glucagon, and these two hormones control our sugar in the blood. Emesis means vomiting. The word here from here I bake is hypermeasures gravidarum. Hypermeasures gravidarum. Hyper mean excessive, emesis mean vomiting, excessive vomiting, gravida mean pregnancy. So hyperemesis gravidarum is excessive vomiting due to pregnancy, and when we know some girls when they become pregnant they have too much vomiting, excessive vomiting during the first 3 to 4 months of pregnancy. That is known as hyperemesis gravidarum. Hyperemesis gravidarum. Anorexia, bulimia, we done. Chilo is lips. Chil is another word root for lips. We have two lips, upper lip and lower lip. Chilorexis, rupture of the lips that happen in accidents. So we have to repair, stitch it. Chiloraphy. Sometime a part of it is lost. So we have to do or damage. So we have to do chiroplasty. Ano is anus, which is opening of the rectum, or the last 1.5 inch of the rectum, which is like a tube, anal canal. That word root is anaplasty, plastic surgery of the anus. Peristalsis. This is a involuntary contraction and relaxation of the muscles of the intestine that create wave-like motion, and that is known as peristalsis. This is automatic movement that is carried out almost the whole day, and especially when we take our meals, and that push the food from the mouth down into the rectum and then out. That is all about medical terminology of GIT. Thank you very much.